half of our program. In this half of the program, we're going to hear from the candidates for 2 hospital commission seats. For Commissioner Position 3, it's Matt Reddy and Marc Mauney. And for Position 5, it is Jill Buhler and Savannah Hensel. So I will let them introduce themselves and tell you what they think is important about their candidacy. So we'll start with opening statements. All the same ground rules apply here, so we won't need to repeat all those. So Matt, we'll start on here with you and get started.
Okay.
So hello, thank you for inviting us to speak here today. My name is Matt Reddy, and I've worked at Jefferson Healthcare the last 15 years. It's a wonderful place to work, and there are many amazing and talented people there. So for the last 15 years, I've worked at Jefferson Healthcare as a problem solver. The last 7 years as what's called a performance improvement specialist. I'm very good at solving problems. I'm standing before you now because about a year ago, my eyes opened to a problem that I really could not solve for my current position. A year ago, I learned a friend of mine had an excruciatingly painful medical condition for which she would not seek care due to costs. She was already paying off medical debts to Jefferson Healthcare. She did not qualify for full charity care, and so she was forced to choose between mounting debt and rolling the dice with her health. And so she chose to roll the dice. I've since learned that my friend is far from alone. In fact, 1 in 7 people in our county did not get medical attention in the last year due to cost barriers. 1 in 3 delayed seeking care due to cost barriers. This is a serious problem. I want to do something about it. We have mothers refusing ultrasounds due to cost. We have patients refusing x-rays and MRIs. We have patients unable to get the medications they need. The charity program does help a lot of people, but for many people it tells them, instead of a $5,000 bill you cannot pay, here's a $2,000 bill you cannot pay. And so they learn to not seek care at all. In addition to access, we have troublesome gaps in mental health and chemical dependency services. It's critical that we begin facing these gaps head on. As hospital commissioner, I'm going to advocate the board to make access a top strategic priority and work with our health department to accurately assess the healthcare needs of our community. So I'm very excited about this opportunity. I'm looking forward to your questions, and I'm looking forward to sharing my skills with the board. Thank you.
Good evening. Thank you for inviting us here tonight. I'm Marc Mauney. I've been a healthcare commissioner for 6 years now. I'm a retired physician and was the pathologist at Jefferson Healthcare for 20 years. I'm sure many of you have noticed some of the recent positive changes that have occurred at Jefferson Healthcare, such as our affiliation with Swedish Medical Center, some of the minor campus improvements, such as better looking hallways, better signage, better parking, a much nicer cafeteria, and a great new chef. We've added many new services, such as our walk-in clinic, many new cancer services, our orthopedic rehabilitation, swing bed unit, and the new Port Ludlow Clinic. There have been many recent accomplishments that are not as apparent as the others, such as our national DNV accreditation, College of American Pathologists certification in the laboratory, and recently Jefferson Healthcare was named in the top 7 hospitals in the state for surgery by Consumer Reports based on Medicare data. We are one of only 148 hospitals in the nation to attain the baby-friendly designation by the World Health Organization. We've also attained a degree of financial stability that we haven't seen for many years at this hospital. Because of this, we've been able to embark on many new projects, the new Emergency and Specialty Services building, and we're able to do it without asking for public money. Because of this financial stability, we're also able to continue to care for every resident of Jefferson County, regardless of their ability to pay. We need to continue on this path. Thank you very much.
Thank you to the League of Women Voters for putting this forum together for all of us. I really appreciate it. 1 in 7 people in Jefferson County did not receive the care they needed last year because of the cost. I am one of those people, and I have cared for many people in the same position. As a home caregiver, I have firsthand experience arguing with insurance companies over the phone, trying to get my grandmother the care she needed while she was dying of cancer. And she, like many people in our community, had Medicare and supplemental insurance. Working as a nurse's assistant in town, I have watched countless families refuse care for their elderly loved ones because of the cost. And as a working single mom, I know what it is like to live in this community without health insurance, to avoid seeking care because of the cost, and to be hounded by our hospital's collections agencies. I will use these fresh, contemporary experiences to advocate for changes that are vital to the health of our community, like making costs transparent to hold the hospital accountable for its billing practices, and to let people know exactly what they are getting into when they seek care. By providing mental health resources for our ER staff, because many people seen at the ER have overlapping physical and mental health issues. And by providing education and training for caregivers, because our hospital district is well positioned to provide training for these people who care for their elderly loved ones at home. Finally, we need to reinstate programs neglected by my opponent, like the Health Data Advisory Board, because if we don't know what the problems are, we can't solve them. And also the rural OBGYN program, because the sooner we access rural women, the healthier our future will be.
What is your name?
Savannah Hensel.
Hello, thank you for being here so late and sticking with us and hearing what we have to say, and to the League of Women Voters for having us here. For 3 terms, I've worked hard as your commissioner because I believe that high quality basic health care for every one of our residents, regardless of their ability to pay, is the foundation of a thriving community. During my tenure, I've gained in-depth knowledge of the industry and experience in how to make it work for us. On the national and state levels, I fight in Washington, D.C. and Olympia to keep us financially strong, bringing $6 to $10 million annually to our community through the critical access hospital designation alone. On a local level, I am current chair of the Jefferson County Board of Health to further the collaboration between the hospital district and the health department for the benefit of our community. Jefferson Healthcare is in a strong financial position and is a nationally recognized award-winning leader. For example, Consumer Reports, as Mark said, we ranked Jefferson Healthcare in the top 7 in Washington State for surgery in the company of Swedish UW and Providence. We are responsive to our community. We conduct public forums in every part of the county to monitor our progress, see how we're doing, and what we need to do better. You asked for more access. We heard you and added 5 clinics. You asked for more services. We heard you and added 7 new services with more to come. But as much as we've done, there's still more to do. The Affordable Care Act is the biggest reform in healthcare in nearly 50 years, and its impact is huge and complicated. If we get it right, Jefferson County will benefit greatly. 3,200 Jefferson County residents will be newly eligible for insurance, but it's not without its challenges. It will take leaders with experience to successfully implement the law. I'm ready to use my experience on your behalf to enact healthcare reform as it benefits our community and our hospital, and I need your vote to do that. Thank you.
All right, Dennis.
Yeah, I am totally confused already. I'm hearing that there are lots of people in our county that aren't getting services, and I'm also hearing that there is nobody that hasn't been served. I'd like each one of you to address that specifically, and what statistics or where are you getting that information?
Jill, we'll start with you down there.
Okay, I don't know where they're getting their information. It's not information that I've ever run into. I do know that our information is, we have never turned anyone away. We have one of the friendliest charity policies in the state of Washington. We do everything we can to make health care affordable to every member of our community, regardless of their ability to pay. We will expend, we have 4 counselors that work with patients who request that they be helped with payments, and we do not send to collections until we absolutely have to, but we have to work within the law, because in the end, it's your money. We are a public hospital district, and just as we can't spend your money without being very careful about it, just like, it's the same as the city and the county. They can't forgive a debt that, because somebody can't afford to pay their water bill, and my time is up.
Savannah.
This information that we got from, Matt and I met with Jean Baldwin up at the health department, who's the director. And this information came from the last health data advisory committee. They did a survey, which we used to do every 3 years. There used to be an in-depth survey done of the people who live in our county, and it was very detailed down to like, did you receive care? Yes or no? If you didn't, what was it? Because you didn't get transportation, because you couldn't afford to pay for it. The last time this survey was done was in the early 2000s. And what our community did with that information was they used that to figure out what the gaps were in healthcare and prioritize them and started addressing them. And if we don't do that, then how do we know what the problems are? It is true that the hospital does take you regardless of whether or not you have insurance.
So the 1 in 7 is from 2000? 2000?
Mark, you want to
2010.
talk about that?
Yeah. This was my one visual aid, and I wasn't going to use this until the end, but this is Jefferson Healthcare's charity care as a % of revenue. This is all our neighboring hospitals, Olympic Medical Center, Harrison, and Whitney. And as you can see, this is from 2006 to 2012, and it's going much higher this year. It was about just under 2 million in 2006. It's headed toward 10 million this year. There's only so much we can do. We're already giving 2 to 3 times the charity care of our neighbors. And indeed, care is not free. Our budget is $70 million a year, and that has to come from somewhere. The more charity care we give, then the higher our prices have to go to cover that charity care. Our charity care is covered right now by the commercially insured patients. Medicare and Medicaid only, barely, in fact, does not cover the cost of care. There's a lot more to that question, but that's all I'm going to say right now.
Matt.
So it started for me with actually talking to people, people like Savannah, who are not able to get care due to cost. Then I started researching it on our own health department, which Jill is on the board. She should know this. They have on their website 1 in 7 people in our county did not get the health care they need in the last year due to cost. This survey is done by the Center for Disease Control on a national basis for every county. It's called the Behavioral Risk Factor Surveillance System. It is done every 3 years. There's other studies. The Kaiser Foundation did a study. They ask a slightly different question. Did you delay seeking health care due to cost? That's 1 in 3. So it's 30% nationwide are delaying care. And that's because this is a nationwide problem. Yes. So yes, the hospital doesn't refuse anyone if they cannot pay. But if you cannot pay, they come after you. They send you to collections. And this incentivizes people to stay home and not seek care. That is why we have a broken system.
Yes.
I'm Tony Harriman. I'm 72 years young and on Medicare. I'm a retired business executive with 45 years experience. I'm the past treasurer of the Library Foundation and the Jefferson County Historical Society. My concern as a patient 6 times in this wonderful little hospital is that we have a budget of $70 million a year, very complex. 70% of the people that walk in the door are just like me, on Medicare or Medicaid.
So we need a question here from you soon.
Okay. Specifically, what in your past work experience prepares you to handle what is arguably the most important, complex job in the county?
Mark, we'll start with you on that.
Well, in my former life, I was the managing partner of a large pathology group. We had between 50 and 100 employees, depending on what time period we were talking about. We had an annual revenue of around $7.5 million. We were a very successful group. That's one thing. I also have 3 I'm the principal partner in 3 commercial real estate businesses. One of my avocations is studying economics. I love economics. I love to read about business and economics, and I don't need more time. Thank you.
Matt.
So the last 15 years I've worked at Jefferson Healthcare. I started in the computer department, and the last 7 years been in what's called performance improvement. I'm basically a problem solver. I can go into any sort of situation, any business, any process, and this is what my job has been the last 7 years. I'm assigned to look at it, to look at how it works, and help everyone there see it in a different way, and see the process in a visual way, see where it's breaking down, help them measure what your goals are, and see why the process is not achieving the goals, and then see how you can implement countermeasures to better achieve your goals, and manage and do what's called change management, because if anyone's ever tried to change something in a business, it's very difficult, because there's always resistance, and so you have to know the strategies to overcome those things. And so my job has basically been to help the hospital achieve its goals from the inside. I've worked very closely with Mike Glenn and other leaders, and I'd love to tell you more about that.
Savannah.
I've worked at a local restaurant down the street for the last 5 years, where for the last 4 years I've helped manage it, the front end of it, and I've done a lot of bookkeeping there, hiring, firing people. But a lot of my experience comes from living in this community as a working uninsured person, and having the passion and the drive and the commitment to really working with people and collaborating and figuring out what we can do to help healthcare needs in our community. And being someone who's been so involved working in a local business, I have the ability to work with people and to be innovative and creative, and to bring a perspective that currently isn't being offered on the board.
Jill.
I'm scared to death I'm going to knock that fish over. I was appointed to fill a vacancy on the Hospital Commission Board because of my business background, my education, and my governing board experience. And that was 3 terms ago. I have a BA in journalism. Business-wise, I built a small 24-page magazine into a 300-page nationally acclaimed publication with a multi-million-dollar budget. My civic duties, I've been president of the Port Townsend Chamber of Commerce, treasurer of Kiwanis, Port Townsend Kiwanis. I'm secretary of the Maritime Center, on the Rotary Run Board. I've served on many committees for city and county government, and I belong to AAUW and Jefferson Healthcare Auxiliary, ELTS, and Mensa. And since my appointment to the hospital board, I've been reelected 3 times, and so I think I've learned, I hope I have, a thing or two about Jefferson Healthcare, so those are my qualifications.
Yes.
I've heard many of the services, I've lived here for a few years, but many of the services that you do, I've heard surgery, OBGYN, pediatrics. Jefferson County has the oldest population in Washington, and this county is one of the oldest 10 counties in the nation. What happened to geriatrics? I haven't heard a word about handling geriatrics at our hospital.
Jill, you want to start with that one?
Geriatrics Geriatrics is a specialty that we are hoping that Swedish will share one of their geriatric people with us. That's one of the reasons that we collaborated with Swedish Hospital, because they are, and when I say collaboration, it's a really good benefit to us, because we have a 90-day out clause anytime we need it. If we want it, I'm kind of floundering here because I have so much to say and I can't get it in a minute, and I'm kind of trying to figure out how I'm going to do this. But anyway, geriatrics is something that we have looked at and we continue to look at, just as we do every other service that we offer and that people want. Dermatology is another one. Cardiology is another one. Cardiology, we do have people coming up on a periodic basis. But oh, sorry.
Savannah.
I see it as a problem, and I know it is because I've worked in that field. I worked as a caregiver for 2 years to my grandmother, and I've worked in town as a nurse's assistant at a long-term care facility. There's a lot our hospital district could be doing. We could start educating and training people who choose to care for their elderly loved ones at home, so they're really well positioned to emotionally and physically care for them in a way that benefits both of them. I would really like to see the hospital partner up with the long-term care facility in town and really help make improvements to it and start giving people the care that they deserve.
Mark.
I understand the issue. A friend and colleague of mine who retired recently, Dick Lynn, said that for him, a pediatric patient was anybody under the age of 70. And, but on the other hand, all of our internists and family practitioners, the bulk of their practice are patients that are over the age of 60. And while it'd be nice to have a gerontologist, I'm not sure that that's an essential need in the county. I'm not sure how much that will add to the services that we already have. I have thought that it would be nice to have somebody like that to build the umbrella for all of the geriatric services the hospital offers. And so I think that is something that we have talked about. We've talked about it actually for 5 or 6 years now. But whether it happens right away, I don't know. I think that's a specialty that's in big demand, and there are a few of them.
So you're probably right. That probably is something we should look into. I don't think the hospital district is doing the best it can to assess the health needs of our community. The way you do that is by doing a community health needs assessment. And that's what Savannah was talking about. Back in 2003 is the last time we did a thorough community health needs assessment. And there was a group called this Data Advisory Committee that the health department and the hospital and other partners were on. And their job was to look at the data, see the healthcare gaps in our community, and come up with strategies, long-term strategies to fill these gaps and meet these needs. Because we haven't been doing that, that is why perhaps geriatrics, mental health, chemical dependency, we are not adequately addressing these. So we're not seeing them clearly. And of course, access. We're not seeing these problems and challenges in our community clearly, so we don't have clear strategies for how we're going to address them. And if we're about to build a $10 to $20 million building, we should really make sure we are really assessing the needs of our community so we build the right facility. Thank you.
Yes.
Me?
Yep.
I would like to know what your plans are, what your vision is for the wellness programs.
Matt, we'll start with you.
So wellness and preventative care is essential to a healthy community. So I think the purpose of a hospital district is a healthy community. That's its fundamental purpose. And sometimes I feel like the hospital district loses sight of that. And it worries too much about how do we maximize profits so that we can be as strong as possible financially. And that's not our purpose. We're not a private company. It's like the fire department shouldn't be out there trying to figure out how to maximize its profits. It's got a purpose. It's to put out fires. Our purpose is a healthy community, so we should constantly be thinking about what programs and what activities should we be doing as a hospital district to make sure our community is healthy, make sure our chronic disease patients are getting the care they need and have the facilities and programs they need in our town.
Mark.
I think that we will continue to do the things we have been doing. Diabetes education, exercise for health, the many other educational programs we're doing. We've been going out into the county with more educational programs, and there's no reason we would stop doing those. In fact, we plan to enhance those. I think there's more we could probably do with the health department in terms of some of the greater health issues in the county, such as obesity. I know that's a big issue for the health department and the state overall now. Yes, I think that's an issue that we will continue to do what we are doing.
Savannah.
I think that there's a lot that we could be doing. We could be going out and teaching people more about food nutrition. You know, we live in a place where we're surrounded by beautiful farms that grow great produce, and we could start teaching people about that and getting into the schools and teaching kids about making good food choices and providing other ways of transportation. Like, let's start carpooling and riding bikes if you're able to, and really getting people excited about being active and being involved in our community. We have a lot of really great resources in our backyard, and let's start accessing them and helping each other become a more healthy community.
Jill.
Savannah's absolutely right. We should be out there, and we are. Chef Aaron Stark has a program where he is teaching right now women with infant children how to prepare nutritious and inexpensive food. He demonstrates the same things at the farmers market. So we are out there doing that, and wellness is absolutely the way to go. And that is one of the reasons with our new building, we are going to expand the whole lower floor where the rehab is now, or the exercise is now. That whole lower floor is going to be for exercise and wellness. And so, yes, it's a very important part of what we do, and we will continue to do more.
Yes, all the way in the back.
Here there's going to be added building and there are a lot of added programs. That must mean there have been some profits. What is the profit for the hospital this last year that it has made so that it can put this money and not ask for public money? I mean, if you're not asking the public for public money for public hospital, you're getting the money from somewhere. What are these profits?
Jill, you want to talk about that?
Well, actually, we don't make a profit. Our hospital is a public hospital district, so profit is not in our vocabulary. What we do is if we put money into reserves for a rainy day or to capital projects such as this, and the way that this building is being funded with the USDA loan with right now 3.5% money, which is just fantastic. And the reason we're doing this is so that we can expand services, so that we can capture some of the people who are going out of county now to come home to Jefferson Healthcare, so that they will be using their own facilities, and we will expand services, and that will help pay for the expansion. We also want to put an expanded ER, and we want to put a safe room in there, so people with mental,
Savannah.
I'm pretty sure that the hospital profited $4 million last year. So they are making a profit. And I believe that if our hospital district is willing to spend millions of dollars to build a new building, then let's do a health needs assessment and really figure out what the gaps are in healthcare in our community and build this building to try to fit as many of the healthcare needs as we can, like mental health and chemical dependency and whatever other gaps there are that we're not seeing or serving.
Mark.
As Jill said, we're a public hospital. There's no such thing as profits. We don't have shareholders. We don't pass out our money at the end of the year. Anything that we are able to keep above our operating expenses goes toward capital improvements, new equipment, new buildings, expanding our services. And I think people are forgetting that 6 years ago, this hospital was on the edge of insolvency. We were cited by the state auditor that we were imminently going to be bankrupt. We had 30 days of cash on hand. That's enough money to run the hospital for 30 days. When we installed Epic, we have already used up 3 times that amount of money in getting the building backed up. Well, it will come back, but right now that money is not there. We wouldn't have been able to install our new health information system if we were now where we were 6 years ago. I think that it's also essential for people to realize that the other place that anything I finally spoke too long.
So the point is, the hospital had a positive margin of $4 million last year, which if it was, that for some reason they're refusing to call that a profit. It had a $4 million positive margin last year, which it puts into the bank and uses however it decides to use it. And so if we can, and of course you have to manage your financial resources, and Mike Glenn is an amazing businessman and a business manager, and he has done a great job in helping us manage our finances. I just see it's the commission's job to be the conscience of the organization and remind Mike Glenn and the facility that the purpose of the hospital district is a healthy community. And so if we have money in the bank, we should be thinking about how do we use that money to best serve the health interests of our community. And I just think we can do a better job at that because, as Savannah and I keep saying, there are definitely healthcare gaps in our community that are not adequately addressed. And I just don't think we're adequately planning and looking at these.
Betty. So many people, so many questions.
I'd like to know a little bit about the person behind the candidate. Can each of you tell me, and we might not need to hear from Jill because she kind of talked about her involvement in the community, but what kinds of groups and organizations and clubs are you members of or affiliated with? And each of you has a personal either website, blog, or Facebook page. What are 3 things on your personal site that you would like to have each of us in the room here know about you?
Matt?
I would have liked to have thought about this one. A little bit about me. Well, I used to be the high school varsity volleyball coach. I was very into volleyball for years until my knees gave out. Loved to hike and camp, and I've lived on the peninsula about 18 years. I've got 5 adopted kids, and let's see what else. I do have a personal website called mattready.net. I'm a big believer in meditation and mindfulness practice. I think it's a really healthy practice, and so that's something that if I get elected and I then have to give up my job at the hospital, that's something I might become certified in, something called mindfulness-based stress reduction. It's actually something that the hospital does have a program in currently, teaching. Yeah, so that's a little bit more about me.
Yeah, Mark.
Well, I have 2 children still at home, an 11-year-old and a 13-year-old. We're in a homeschool-based program. I'm part of the school district. I have volunteered, both my wife and I have volunteered dozens and dozens of hours to the Chimicum School District. I also am active in the Pi String Orchestra with both of my boys. And I have both coached and managed their soccer teams. I'm running out of things here. I play golf. I'm part of the Golf Association down in Port Ludlow. And I'm trying to think of 3 things. I'm not sure I quite understood what that was, the 3 things on
On your blog that you want us to know about you.
about me personally.
Mm-hmm. Just
Uh-oh, just ran out of time.
Saved by the bell. Yeah. So, Savannah.
So I moved here in 2002 from Seattle, and I graduated from Chimicum High School. I'm a 3rd generation Jefferson County resident. My grandfather, standing back there, came to watch me tonight. My dad graduated from Fort Townsend High School, and my son was born here. He's 6.5. When I can afford to, I'm a student. So last year I was a full-time student and doing prerequisites to hopefully get into nursing school. I have a huge garden, and we keep chickens, and I try to ride my bike as much as possible. And I really love Fort Townsend. I'm happy to call this place my home. And I think that's about
Jill.
Well, my mother is here.
It's a family affair.
Yes, and she's a Port Townsend High School graduate, and as was my dad, and I've been affiliated with Port Townsend all of my life, and didn't live here, grow up here, but returned every summer to visit family and friends, one of whom was John Buhler, who used to have to babysit me when I came, and hated it because he's 4 years older than me, which now is nothing, but then it was kind of a big deal. And he tried to lose me every time I turned around and played all kinds of dirty tricks on him. And I told him that someday I was going to get even with him, and it took me 30 years, but I married him. So we have a blended family of 4. I'm a photographer now. I do photography and writing, mostly commercial photography for real estate. Let's see. Things to know. I'm currently on the Mental Health and Advisory Board, and my time is up.
Julie.
As I understand it, the CEO of the hospital makes more than the governor at this point. And that offends me in this little teeny rural county. And as I hear it, you're about to launch on a $20 million capital project, and you just finished buying up a building for $7 million that was appraised at something less than $2 million. And you've just got money rolling around here in big-time centralized projects, or so it appears to me. So what I want to know, and what I'm curious about, is what kind of vision do you have for 21st century decentralized caregiving in all of its aspects, through computers, in-home servicing through computers to people's homes, rather than trying to draw people to a centralized hospital, which is the last place really healthy people want to be going.
I went to that, the iPhone.
There's an app for that, I think. Mark, you want to start with that one?
That question is way too big for me. I think that medicine is going to change. I think keeping Jefferson healthcare open so that people don't have to travel 60 miles for the healthcare is one answer to that question. And I think the financial health of Jefferson healthcare is another answer to that question. I think there are certainly changes that are going to occur in the way healthcare is delivered, and already has occurred. Healthcare 40 years ago, 75% of it was in the hospital. Now 75% of it is outpatient surgery, outpatient.
I apologize for this noise.
Outpatient testing rather than inpatient care. As far as more care occurring at home, I think that there's lots of things that will evolve. I think there'll be more communication with your physician electronically through email and other electronic means. I think that's coming. I think it's already here. So I think that's the answer I'm going to give.
And Matt?
So there's a lot in that question. So basically my vision as a commissioner is the commission works with Mike Glenn and the other strategic leadership to draft a strategic plan which sets the goals for the institution. And that is really the key part of the commission job. It's you set the clear goals for the hospital district. And again, why I'm running is because I don't feel we have quite the right goals on the strategic plan. And so you set the goals, then you measure how well you're doing to achieve those. And ultimately, the commission is simply holding the CEO accountable to achieve those goals in the best possible way. And if he is not achieving those goals, then it's the commission's job, and their primary power is to hire and fire the CEO. And so that's basically how I see it. And if we put my top priority is access. 1 in 7 people have not sought the medical care they needed in the last year due to cost. That's 14%. So I would say, let's get that down to 5% in 2 years. Get that down to 5% and we'll be #1 in the nation. So, and if we don't achieve that, then that's a problem.
Savannah, let's go with you.
Speaking to the first part of your question, about the building purchases and the cost, this is a very good reason of why I strongly believe in transparency. there needs to be a lot of transparency, especially for large purchases such as the McCarran building and building this new building. It's going to cost millions of dollars. We really need to be transparent with all of the business dealings that we do and really educate the public about this so they can help inform us so we can make decisions on your behalf. I mean, like, you all are electing the people on this board. We should be representing your interests and your needs and really strongly advocating for them. And as far as the coming century, I think we really just need to really look at what the needs are and start filling in those gaps.
Well, first, the building was appraised by an independent appraiser for $7 million. And what you're talking about is the assessment, the county assessment that Mr. Westerman did. And he assessed that building before it was completed. And the completion that, when he finished it, it's much more expensive to build clinic space than it is to build, say, office space. So it was a fair appraisal. Mr. Glenn's salary, I don't know what the government makes, but when we set his salary, we looked at everything, at the salaries of other CEOs of like hospitals in our area. And I can tell you, for example, of the 25-bed hospitals in our region, Mason General pays $241. Whitby General pays $231, and Jefferson Healthcare pays $233. So we're in the low mid-range there. Time is up.
Yes.
I would like to hear from each candidate what your top goal would be for Jefferson Healthcare.
Top goal. Savannah, you want to start with that one?
My top goal is access. Living in this community as a working uninsured person and knowing many other people in many demographics, not just young people like myself or families, but also caring for elderly people in our community. Access is one of the biggest priorities for me because it's a really big problem. There are many people in our county who are not able to get the services that they need because of the cost. And a lot of them already have insurance, so it's being underinsured. And something that I'm going to do to help solve this problem is advocate for single-payer universal health care. And through the Affordable Care Act, we are given the opportunity to create something like this for Washington State. And currently, there's a bill going through Olympia created by a woman named Sherry Appleton over in Kitsap County. Last year was House Bill 1085, and this year it's going to be a different name. But we could be, as hospital commissioners,
Proactive.
My top goal is to be in the top 100 critical access hospitals in the country in every way. And that's patient safety, patient quality, and access. And one of the things that they keep mentioning, Savannah and Matt, is a needs assessment. I sat in on a meeting last week with the Public Health Department and Jefferson Healthcare, where we are already in planning and starting a health needs assessment. The reason we haven't done it since 2000 is because it's very expensive to do, and we do have the funding to do it, and we are embarking on that. So the gaps that they're talking about, we will be assessing them and identifying them and doing something about them, filling them. I guess time is up again.
Mark.
I could say that my goal is to be in the top 100 access hospitals, like Jill has said, but really, that's just one piece of my overall goal, and that is to have the community, the entire county, rally around this hospital. Not just because it's local, not because they're supporting businesses that are local, but because it has top quality care, it's affordable, and it's the right thing to do. And if we can do that, if we can make this hospital what it can be for the community, so that happens, then then we've answered all the questions we can do. There will be access, healthcare will be affordable here, and the quality will be great.
Matt.
So I think I've said this a few times, access is my top priority. If I hadn't been faced with my friend in that painful medical condition and my eyes had not been opened, then I would still be enjoying my very comfortable, well-paying job at Jefferson Healthcare. I would not have turned my life upside down and run for hospital commissioner. But access is a problem, and we need to be more innovative in how we approach this and how we approach healthcare costs in general in this country. So as commissioner, I'm going to push the commission to pursue every innovative local program we can do to try to solve this problem with our current resources. But we don't have enough resources to completely solve the access problem, and that becomes my job as commissioner to go to Olympia and DC and advocate for the type of healthcare reform we need to really solve this problem, which is, as Savannah said, probably single-payer universal healthcare. As she said, we can do it through the Affordable Care Act in 2017, so I'll advocate for that.
Time for one more question. Who will it be? You.
I have a question about transparency and affordability too, and I sort of want to make an observation. I sort of feel like there's a difference in perspective from making high status facilities on the one hand and making access for patients on the other hand. We've been reading a lot about the charge master prices and how much they exceed the Medicare reimbursement rate. And I was just in the hospital for 4 days, and so I've had firsthand experience on that. I found out it was like pulling teeth to find out what the Medicare reimbursement rate was. And from my reading, I was told that I'm supposed to be a good consumer and to question the costs. It was very hard to find out the Medicare reimbursement rate, number one.
We need a question.
Okay, what are you doing to reduce costs? Because I ended up with a huge bill. I know people are going bankrupt. I know people are being sent to collection. And I would rather actually have access than new facilities, personally, affordable access.
Matt, you want to start? Okay. Can I just shut this off for a second?
Yes.
Do I need to talk into the microphone still?
No.
Okay, I'll just talk loud. So healthcare costs are out of control in our country, and the stories that have been talking about charge masters, they just illustrate that. In terms of transparency, we should publish our charge master on our website. Someone asked the commission to put the charge master to publish it, and they sort of talked their way around it and said it's too complicated, but it's not. I've seen it. You can just put the whole thing on the website.
What's charge master?
Charge master is a list of charges. It says everything we charge for every procedure. Now, it's a complicated story because there's what we charge for the procedure, there's what Medicare pays us for the procedure, and there's what every insurance company has negotiated to pay us for that procedure. And that's why it's such a complicated mess, and that's why we need to clean up the whole system and put what every other industrialized country has done, and that is a single-payer universal healthcare system. To have, they spend half as much. They spend half as much per person per year on healthcare because they have a smarter system. And we could do that here if we have the local healthcare leaders to help make it happen.
Yes.
Mark. That doesn't work. Oh, this guy. Have to build it out.
I understand that finance of healthcare is a mess. I can't justify why we charge what we do. I can't do it. But we do because that's what Medicare reimburses us, that's what Medicaid reimburses us, that's what insurance companies will reimburse us. As far as having facilities that patients want to come to, I think that's critical. Medicare and Medicaid don't pay for the cost of care. So how do we have any charity care or any capital improvements if we don't have commercially insured patients? If our patients leave the county, if they go to Harrison, if they go to Olympic Medical Center, if they go to Seattle, we will have no hospital. It's as simple as that. We have a $70 million budget, half of it is Medicaid and Medicare, the other half are commercially insured patients. That commercially insured patient subsidizes about $15 million of charity care, bad debt, and capital improvements. It's as simple as that.
Savannah.
Transparency is something that I really strongly believe in making costs transparent and upfront. You are empowering people who come to these services to have the ability to decide whether or not they can afford to pay for it. And if they can't afford to pay for it, then we as a hospital commission board need to look at what we're doing and change the costs and how access is a problem and make it affordable and accessible for everyone who lives here. There are sorry. It's something that we need to do to let people know what they're getting into when they come to the hospital to seek care. And something to help, that's something we can do in the meantime while we're trying to get universal health care through the Affordable Care Act in 2017, which is something that
our charges are very competitive. The Washington State Hospital Association produces a document comparing the average charges for the 10 most common procedures done in hospitals. And Jefferson Healthcare is below the state average in 7 of the 9 that we actually perform. And our goal is to make it all 9. On the outpatient side, our board challenged, we heard that some of our charges were a little high. So we challenged administration to study our costs, be competitive, and they did. And so we reduced our CAT scans and our MRIs by 25 and 30%, and we reduced our lab work by 7.5%. We are working hard to keep costs down. We haven't raised our tax levy in 4 years. And we work with our patients to make healthcare as affordable as we possibly can.
It's time for closing statements. So Jill, you want to start on your end?
My opponent claims to be a voice for access to all, yet she is ignoring the new law that would help 3,200 of our residents and instead is putting all of her effort into advocating for a single payer system that does not exist. The bill that she's referring to never made it out of committee. It's a dead bill. So there is no bill to advocate for, as she said she would do. There's a huge difference between social activism and the role of commissioner, which is governance. I understand my opponent's concern because I too was a single working mom. If she were more experienced, she would understand that the role of a hospital commissioner is not to change the law, but to work within the system for the betterment of Jefferson County. To think that the role of a hospital commissioner is as an activist is misguided at best and downright reckless at worst. God bless the activists. They made this country what we are today. But while she's up there trying to advocate for a bill that isn't in existence, I'm focusing razor sharp on making the Affordable Care Act work for the residents of Jefferson County and to not do anything that diverts attention to a single payer system. There are 3,200 lives at stake, and shame on me if I allow my personal beliefs to come before my county and my hospital. I'm ready to use my experience on your behalf, and I need you both to do that.
Okay.
I think that our perspectives are based off of our life experiences. Where we come from, where we live, and the struggles of our families, friends, and of ourselves. My opponent has claimed that I am out of touch with reality. I think this is an example of her failure to branch out of her own life and to understand how many realities really exist for women in Port Townsend. When elected, you can be sure that I will use my fresh, engaged, and contemporary outlook to advocate for all of the healthcare realities in our community. I will use my life experiences as a working uninsured person in this county to bring a perspective to the board that currently is not being offered. Vote for me, a working mom for change.
So I've already showed the snapshot of financial access in the county. That's just statistics. And we have 4 financial counselors dedicated to helping people work through financial obligations, whether it's subsidy, find public assistance, work out payment plans, apply liberal charity care. I think that Matt has referred to innovative, affordable healthcare plans in other counties here and there, and I've looked into those. They're often highly subsidized by tax money, and that's what we're talking about if we're going to have those. And the Affordable Care Act takes effect in just 2.5 months. We're going to be insuring another 3,200 people in Jefferson County under that act. One of Matt's goals is to change healthcare funding at a state or national level. That's just not realistic for a board member of a 25-bed rural hospital. If Matt wants to do that, he needs to run for the legislature or for Congress. Our role as Jefferson Healthcare Commissioner is governance of Jefferson Healthcare. And based on every indicator, whether it's access, quality of care, or financial stability, the current board is doing a great job right now. Thank you.
So many of the challenges our hospital district faces are not unique. They're shared by healthcare systems across our state and across our nation. As commissioner, I will work tirelessly to leverage our local resources and ingenuity to improve our district operations, and I will use my position as commissioner to advocate for better state and national healthcare laws. I think that's part of the job. We can have a healthcare system that is world-class, costs less than our current system, and provides access to every single member of our community. But to get there, it will take healthcare leaders at every level that face the shortfalls of our healthcare system head on. The hospital has achieved many great things over the last couple of years. But many of the hardworking people who actually did the work to achieve those things are endorsing me. I'm proud to say providers like Dr. Carrie Day of Jefferson Medical and Pediatric Group, hospitalist Dr. Judy Gain are both endorsing me. Marilee Mounts, South County Medical Clinic. We're very proud of being a top 7 hospital in surgery. Well, the director of surgery, Florida Rue, is endorsing me. The director of our fabulous Family Birth Center is endorsing me, Kirsten Picard. The director of patient safety and quality believes in me, Brandy Manuel. The director of dietary, Aaron Stark, is endorsing me. The director of 2 primary care clinics. In fact, 14 of our current directors are willing to endorse me. These are serious people, and I hope you'll appreciate it takes some courage for an employee to publicly endorse someone opposing the current sitting president of the board. They're sticking their neck out to support me because they believe we need a change. They believe in my skills. They care deeply about our community. They've seen the work I've done there over the last 15 years, and they know I will be an amazingly positive part of this board and help our district really thrive. So I hope you will help me vote Matt Reddy for hospital commissioner and give me a chance to live up to their vote of confidence. Thank you.
Let's thank our candidates. Concludes our program for this evening. Thanks to the lead, AAUW, and Dennis for taping it. Thank you. And good night. Thanks for coming.